As I mentioned at the beginning of this video, there are many kinds of pain, and there are two kinds of pain I haven't spoken to yet. So I just want to touch on them quickly. One kind of pain is what we call visceral pain. So I'm a patient, I have ulcerative colitis and Crohn's disease. When my body is inflamed and stressed out and things aren't going well, the kind of cramping pain that I feel can be quite extreme. So that's just an example of organ pain. You could see menstrual pain, kidney stones, gallbladder stones, kinds of pain that happen within your belly. So it's not a place you can put needles in to treat the muscle. However, when you're using acupuncture to treat pain in your viscera, what you actually end up doing is treating any kind of constraint or guarding around the abdomen on the front, and also using acupuncture needles to stimulate what is called a visceral somatic response. So if this is my spinal column, and there's nerves that come out of my spine that go into, say, my colon for colitis, there's also nerves that come out of the same part of my spine that actually regulate the function of the muscles in this region of my body. The body's very efficient that way. So if I'm using needles that go through all the muscles that visceral somatic nerve are connecting to, there's kind of a feedback loop by reducing the tension in the muscles and the tension in the spine around that nerve that allows the body to shift the alarm status inside, say, your colon. Now, if I'm very precise with my needles and I know what I'm doing and maybe I'm using some electrical stimulation, I can also actively trigger the nerve function to those organs or say my colon or your colon. And that can help reduce inflammation. And also, as I had mentioned, your body will release more stem cells with acupuncture, which once the inflammation goes down, those stem cells help your tissues heal. So acupuncture isn't just killing pain, it's helping your body self-regulate and then self-repair. The last kind of pain I want to speak to is what we call somatic constraint, which has mostly to do with how people hold on to chronic distress and trauma. So if you're a person who's, say, been hit in the back of the head for whatever reason with a ruler because you went to a really strange school when you were a kid and you walked around like this your whole life waiting for someone to hit you in the head with a ruler, especially when you're in situations that are challenging and more stressful, that memory in your body of being hit in the head is held in the muscles that you're using to guard yourself from getting hit in the head. Now that's a very, very simplistic way of describing how people somaticize or embody trauma. But at the same time, it's how you're holding on to a memory, and it's also a way that you're holding on to a memory of how you fit into the world. And that is a very, very important thing when it comes to trauma and also addiction. So this is where that little hack or that little trick comes in to be very, very helpful for people. And this is what we call a somato map. So if you were to take a picture of the human body and put some X's here and some squiggles there and some other places, or however you would choose to actually make the sensations you're having in your body easy to communicate with your acupuncturist, your massage therapist, the person who's helping you with your resolution of trauma, that map gives you a sense of self-awareness and a kind of what we call autonomy or self-agency around facing the fact that that is what has to change as much as the narrative and the stories that you have about yourself and your life. Because they're all held together in the memory of what happened and the memory of what's being still felt in your body. It's a different thing to go to an acupuncturist and say, I have a sore neck, than it is to go to your acupuncturist and say, I was relentlessly, brutally punished as a child, and this is how I'm holding on to that punishment. And now you know that they know that you know that when you're doing the acupuncture for that neck pain, it's actually about visceral, instinctual, constrained somatic trauma. So that can help not only with people who have experienced trauma, especially physical trauma in their childhood or at other times in their life. It can also help someone who had a motorcycle accident or compressed a nerve like that young man I spoke about earlier. So that map, if you take it into your acupuncturist, your massage therapist, whoever you're seeing, and say, this is the way my body organizes the recruitment of muscles around the injury, or this is how my body is actually holding on to a traumatic memory. When you make that honestly clear to yourself and the person you're working with, what happens with the treatment is fundamentally different because you're aware that you're trying to release trauma out of your body, not just make your neck feel less stiff or sore. As a clinician, I've been focusing on autoimmune disease for about 25 years, and Because of that, I end up working with a lot of people who also have PTSD, because people with chronic trauma are more likely to trigger any kind of chronic disease that they carry the genes for. So I'm very familiar with treating pain as an acupuncturist or as a doctor of Chinese medicine. But more importantly, I'm also very familiar with focusing on the PTSD that many of my patients have. Now, because I like to work in a complementary or integrative model, all of my patients are usually on the appropriate diet, the appropriate supplements, the appropriate herbs, the right kind of exercise, the right kind of stretching, so that they're going to get the maximum benefit from the acupuncture that they're receiving. So if you've never had acupuncture, I would encourage you to give it a try. If you're experiencing any kind of chronic pain, especially from trauma or from an injury that's a long time ago, especially if you're experiencing that wounded animal syndrome where you don't feel like you really fit into your life the way that you have in the past, acupuncture is a really good way to start. Call the acupuncturist around you where you live. Ask them if they understand the neurological mechanisms as well as the traditional Chinese medicine understanding. If they say yes, then ask them if they're willing to use that somatic map to help you guide them through the process of resolving your pain. And I can guarantee you at least 80 to 90% of clinicians will say, yes, please bring that with you, so that I have every confidence that what I'm doing as a clinician is going to be precise or accurate, in the sense of acupuncture, to your needs today. So I hope that gives you some perspective on some of the scientific evidence that there is around how acupuncture works. And I hope that gives you some confidence to consider giving acupuncture a try. Again, my name is Dr. Michael Smith. I'm the founder of Autoimmune Health Solutions, and I hope this has served you in some way. Thanks for watching, and I'll see you in the next video.